Staffordshire is a big place, 830,000 people, very different communities from the Peak District to essentially Birmingham Overspill, and this one new community trust, which is 8 months old, 1 month integrated with adult social care from the County Council, 5,500 staff, 355 million budget, 150 million of that is from the County Council to fund adult social care. In order to deal with the issues facing care, we needed a whole system approach, bought into by all the partners, which was built around the individual, the family and the community. Our aims are very much about promoting independence and having a simpler, better and cheaper system. Our experience, sadly, is of dealing with a whole range of organisations that are probably too small to be sustained, who are more bothered about their own future rather than adequately meeting the needs of the population. And I think the important thing for this dialogue is that the work of the Integrated Trust is mainly focused around the re-ablement and the key working. It isn't about managing everything. It is about a particular focus for those people who are either at a point of their life need to receive care that enables them to get back on their feet and not need long-term care, or manages their long-term care more effectively. We're doing a lot in terms of community development, building that community infrastructure. We've got a groundbreaking organisation now called Staffordshire Cares, which enables people to access care themselves. We're working with fire, with police, with public health, with children's centres, with schools, to create the system of early identification, early intervention, and ways in which we can keep people out of the system. We've also integrated with the mental health trusts, like most authorities have. We're setting up a new all-age learning disability service that will have some health input to it, and we're also looking at how we can integrate children's services. And we think it's really important that we build up a network in the third sector and private sector to meet these needs, not necessarily have those within the new trust.
Care coordination is really, really important. We know in adult social care that we have a plurality in the market where we've got many, many providers, and a lot of care is now not directly provided by adult social care. Culturally, that is a huge challenge for the health sector, and if we think only of the transactional things that we have to do, we will totally miss the point. The other thing is the approach to understanding risk is really, really important. At a very simple level, we have health people, people who have health services, and we have people who have social care services. Rarely do we look at that as a whole population and say, how are we going to support the most vulnerable people? And doing that with our commissioners and GPs is absolutely the right approach. So a lot of the focus is about investing in order to enable people to deliver care in the way in which we want to be able to do that. A couple of other points just to finish off. Impacts, we are looking for a research partner who can work right into practice so that we can evidence base what we're doing, and where we start to go wrong, we can turn a different corner. We know there is a huge agenda here around nothing about me without me, which is the strap line. But actually we've really got to mean that. Feel that there isn't a gift from the state and we're being paternalistic, but actually we're a key partner and they're leading the way in which they can either make themselves better or sustain their quality of life. Hugely important. And just finally, be remiss of me not to mention cost really. We worked very much in partnership with the organisations around the setup of the new trust. We shared costs as part of that, although that was difficult. And the other thing I just want to mention is the difference really in how organisationally health feels very top down, dare I say command and control, yes I dare, compared to localism from a local government point of view, and our ability to be able to link in communities and do things that matter to communities and address need is a huge part of how we will improve the health and well-being of our community. So overall, we're nurturing the baby. It will grow and give us all sorts of challenges along the way, and hopefully it will grow up into Torbay and become a very successful example of how you can join up lots of things across the system to make real differences to people, and that's what we're all about. So thank you very much.
Thank you. Is this going to release hard cash, do you think, as you get into the detail of it?
From an organisational point of view, and then I'll talk about from the commissioning perspective, there are very stringent efficiencies attached to this. So the county council services that have transferred over have got to deliver in excess of £20 million efficiencies over 3 years. It's cost improvement, as you'll know, in the health sector as well, and together that amounts to over £40 million over 3 years. But what we also talked about was what the release to commissioners might be if we shift the model of care and we invest in different areas. So, you know, primarily around acute reductions, nursing care costs and prescribing costs. And we have a risk gain share agreement that's tripartite with the Health and Social Care Commissioners as well as with the provider around how we will share either the pain or the gain of that.
Who is going to own this? Are you going to own it as a provider trust, albeit that you are, as it were, lead provider with lots of partners? Who is going to own this in Staffordshire?
Our view is that this needs to be a jointly commissioned enterprise between ourselves and the 5 CCGs. And our aim is to set up a joint commissioning arrangement that will oversee that work and that will tie us into it. We think the Health and Wellbeing Board can have the governance of this new arrangement, but we need the commissioning infrastructure to tie it all together.
Can you actually anticipate that you are going to secure that kind of multidisciplinary working, working across boundaries, shared responsibilities, or are all those professional silos still there?
Having a title of Director of Integration, I've always thought that's about how you integrate social care and health. And actually spending some time in the health economy, I'm actually realising that lots of the silos are between the different parts of the health sector. So I think it's, you know, we talked a lot today about culturally the differences that need to happen there. And for me, it's about how we will invest time in people in breaking down those barriers so that we can work to, you know, from an organisational point of view, common vision, common set of values, an operational way of working that actually means what we say about putting the person at the centre. Because we're really good at saying it and not necessarily always that good at, you know, the system can sometimes drive us away from doing that.
Thank you very much.
Okay, well done.
Thank you.